I am honored to join you today as we commemorate the 2025 World AIDS Day with the theme Overcoming Disruptions, Sustaining Nigeria's HIV Response. This occasion provides an opportunity for reflection, gratitude, and renewed commitment to our shared goal of ending HIV/AIDS by 2030. In recent times, Nigeria has made remarkable progress in HIV prevention, treatment, and care. Yet we must not relent until everyone in need has access to life-saving services. Ending the epidemic requires sustained advocacy, and that is where I come in, because I know one of the people living the survival group, I can't remember the name now, mentioned that, oh, I have to get this, that. I'm not strengthened financially, and these are the people spending the budget. So, but we'll see how we can come in. But when we have resources to do that, I would really love to do that. But with advocacy, I'm just an ambassador to most ministries, and especially health and education, and a little bit of environment, which everything is just very, very important. But with advocacy, with health, I've always been quite passionate towards health. And I forgot that I even worked with NACA and Bill Gates Foundation in the day. That was almost 25 years ago, I forgot. And it's through advocacy at the same time, and not until my relationship with OAFLAD. So advocacy, innovation, care, and compassion, and that is where I come in, especially by confronting the stigma and discrimination that still surrounds HIV/AIDS. Every Nigerian deserves to live free from judgment and exclusion. In the past year, our national focus has been on eliminating vertical transmission, expanding pediatrics HIV treatment coverage, and strengthening local sustainability of HIV response. I am pleased to learn that with the support from the Global Fund, the National AIDS and STD Control Program, NASCAP, has recorded significant progress. This year, in partnership with the Organization of African First Ladies for Development, OAFLAD, the Free to Shine campaign was launched across all the 6 geopolitical zones in Nigeria. This campaign promotes the triple elimination of HIV, hepatitis, and syphilis by 2030, reinforcing Africa's political commitment to safeguarding mothers and children through early testing, treatment, and stigma reduction. We are moving steadily towards the global target of eliminating mother-to-child transmission of HIV, syphilis, and hepatitis by 2030 through efficient use of resources and integrated healthcare services for women and children. However, Nigeria's HIV response remains largely donor-funded. As global funding patterns shift, we must ensure sustainability to prevent disruption of critical services. The federal government, as you have heard, has proactively approved the disbursement of $200 million to support HIV, tuberculosis, and malaria program. Furthermore, I'm also told that NACA has initiated engagements with state governments to ensure long-term ownership, continuity of the national response. As we move forward, I call on all Nigerians to support the renewed hope agenda of His Excellency President Bola Ahmed Tinubu, GCFR, in the commitment to achieving an HIV-free Nigeria by 2030. I commend the Federal Ministry of Health and Social Welfare under the leadership of Professor Mohammed Ali Pate, CON, and the Director General of the National Agency of the Control of AIDS, NACA, Dr. Temitope Ilori, and her team. I thank you for the invitation to be part of today's event. I applaud the contributions of the National AIDS and STD Control Program, NASCAP, donor agencies, civil society organizations, the private sector, and all partners, especially our traditional rulers and religious leaders, whose tireless efforts have kept Nigeria HIV response impactful. And I will implore our traditional rulers again and also our religious leaders, because most of them know about private maternity wards. And I hope they are working with you. Most of them are registered, even those in the churches, okay, because those are the areas we have to really work on. And also I spoke to Dr. Salako today, telling us about young mothers, especially those, you've reduced the age of where they don't need the consent of the husband, of the parents to access this testing, which is being reduced to below age 14. I think that is quite commendable. To our parents, guardians, and teachers, HIV/AIDS is no longer a disease of shame, but should be brought to the table for discussion on prevention and where to get necessary help and assistance. To our young people, I encourage you to take responsibility for your health, get tested, and know your status. To our communities, let us foster a culture of love, acceptance, and support for people living with HIV. Let us continue to show empathy and kindness to all those affected and renew our pledge to end HIV/AIDS by 2030. God bless the Federal Republic of Nigeria. Thank you.